Well, March is National Brain Injury Awareness Month, and just to break down the numbers, more than 13,000 people in Hawaii suffer a traumatic brain injury, including kids, and it could come with a lifetime of complications. To break it all down for us, we're joined now by Corey Liao, MD, a neurologist from Adventist Health Castle. Good morning and welcome, doctor.
Good morning.
First of all, what is a traumatic brain injury?
Traumatic brain injury, or TBI, is just a disruption in the normal function of the brain. It's usually caused by a jolt or a blow to the head. Unfortunately, it's very common. About 3 million Americans suffer from it, and about 50,000 people actually die from it every year.
So it could come from someone falling, it could come from even some kind of, maybe in a sporting event, maybe a ball hitting your head, or maybe someone else knocking your head accidentally.
Yeah, like you mentioned with the surfing, the most common cause of TBI is actually from falling. It causes about almost half the number of cases of TBI, especially in the elderly. In about 8 to 10 cases of TBI is caused by a fall. The second most common is caused by a blow to the head, object falling on the head, or somebody walking and running into something. And unfortunately, the third most common is people that are involved in a motor vehicle accident, hitting the head on the windshield, or something else.
So what if any of those or something else has happened to you and you think you might have suffered from a brain injury? What should you do?
Well, fortunately, Christine, most cases are mild and people do recover well. Here are the symptoms of TBI that I often talk to my patients about. They could suffer, look for the symptoms of change in their thinking, difficulty remembering things. It could be change in the sensation. It could be a persistent headache or dizziness, or even difficulty sleeping or going to sleep. And also change in their emotion. They could be more irritable, they could be more sad. So these are the things to watch out for.
Now, you mentioned symptoms and difficulty sleeping. What if they have those symptoms, they think they suffered a brain injury, and they actually want to go to sleep? Is it safe to let someone you think who may have had a brain injury go to sleep?
Well, great question. One of the things I always tell my patients, if they want to go home after a TBI to take a nap, I always tell them, always make sure that someone is with you at all times, and to wake them up every 2 hours, to make sure that they can wake up. Now, the reason is that because sometimes even hours after the initial blow to the head, a blood clot formed later in the brain. So I would do it for at least 6 to 8 hours. So that's a great question.
And how is a brain injury diagnosed, and how do you treat it?
Well, a couple of things. Some of the warning signs and red flags that I really want my patient to be aware of is they should really seek immediate medical attention if they have nausea, vomiting, if they have persistent headache that don't go away, if they're unaware of things, they couldn't recognize things, and one of the way, and if they're mild, they could just go to the regular doctors. The regular doctors could just do a memory test, could do a brief neuro exam, and if needed, refer them to a neurologist or even a neuropsychologist for a neuropsychological testing to test their memory. Obviously, in severe cases, they may actually need to go to the emergency room where we look for the complications of TBI, like a bleed in the brain, that may need a neurosurgeon, or a bruise in the brain, or what we call contusion, bruised brain tissue. In the moderate to severe cases, then they may actually need therapy like occupational therapy, physical therapy, speech therapy to help them to recover.
So those long-term effects, it could really settle in. It's not just something that should be overlooked, because you could actually be dealing with this for some time.
Absolutely. It's always so important to seek medical attention, if there's suspicion of that, because persistent TBI could lead to long-term effects like difficulty with memory, difficulty with communication, change in the behavior. In severe cases, they may actually develop epilepsy. Patients with TBI also known to develop Alzheimer's disease or Parkinson's disease. So it's really important that we're aware of that.
It is, and we thank you so much, Doctor, for being here and joining us from Adventist Health Castle.
My pleasure.